The National Insurance Board advises that the launch of the National Prescription Drug Plan has been pushed back because contracted suppliers do not yet have delivery of all of the drugs identified in the formulary.
The National Prescription Drug Plan is in the final stages of launching the National Prescription Drug Plan, and the process called for a tender of 165 medical prescription drugs and supplies. Over the past few months, we have signed contracts with the suppliers to provide the plan beneficiaries with the prescription drugs and supplies. We signed contracts totaling over $5 million with the various beneficiaries of the plan. And we're happy to say that the majority of the suppliers have all of the drugs on the island. But because we're very sensitive about the possibility that some of the drugs that are not yet on the island are some of the commonly prescribed drugs, we have decided to delay the launch of the plan until we can confirm that all of the 165 plus drugs and medical supplies are on island.
Dr. Brenna Brown, senior pharmacist for the Drug Plan Office, informed that it had been anticipated, based on contracted obligations and related information provided by the wholesalers, that medications would arrive in Nassau within 6 weeks of the tender awards.
With some of the manufacturers, they work on a production schedule, so they don't make all the products all of the time. And whenever we release the tender, we miss the production schedule for some of those products. And that caused a delay in those products actually reaching to the island. The wholesalers have informed us, though, that the products will be on the island this month. We did not want to start the plan knowing that we didn't have all drugs available, because we didn't want patients knowing that we were going to carry these products to go to the pharmacies and the clinics to pick up the medication, only to be told that the drug plan did not have their supplies in. So rather than cause problems for patients at the point of the pharmacy, we decided to wait until we had everything and we could launch with a full plan.
Tammy Francis, Drug Plan Manager, advises that the formulary guides for healthcare professionals have been published.
We've recently had the formulary booklets published. They are conveniently pocket-sized, packed with information, and ready for distribution. We are happy to report that our patient guides are in their final editorial checks, and they are just as information-packed as the formulary booklets. And both of these, the formulary booklet and the patient guide, will be readily available on our website, and that's at npdrugplan.com.
Following the official launch of the plan, ACE prescription card holders will be able to use their ACE cards at participating pharmacies to obtain free of charge the 165 prescription drugs and medical supplies as described in the drug plan formulary and prescribed by their physicians. To date, 27 private pharmacies in 32 locations throughout the Bahamas and all public pharmacies have signed on to the National Prescription Drug Plan.
Once the medications arrive, we will inform the pharmacies and the public pharmacies and clinics, the private pharmacies and the public pharmacies and clinics, that they can place their orders with the wholesalers. Once those orders have been placed, they should be stocked in the pharmacies, and once we feel sure that every pharmacy has had enough time to order their products, we will open the plan up and tell everyone that they're able to go to the pharmacies to pick up their medications.
For more information, visit the website npdrugplan.com or call the Drug Plan Office at 356-2070.